Are you aware cervical cancer is the fourth most common cancer in women globally, with around 660,000 new cases and around 350,000 deaths in 2022? For this reason, I want you to join me as we educate ourselves on the early signs of cervical cancer. Early warning signs of cervical cancer may not always be present, but there are some common symptoms and risk factors to be aware of. Here are 5 early warning signs of cervical cancer. Number 1. Abnormal bleeding, that is, bleeding between periods, after sex, or after menopause. Number 2. Pelvic pain or pain during sex. Number 3. Abnormal vaginal discharge or unusual odors. 4. Bleeding after sexual intercourse. And number 5. An abnormal Pap smear test result, which may indicate precancerous cell changes. Additionally, other possible signs may include frequent urination, pelvic pressure, abnormal menstrual cycles, painful sex, and heavy bleeding during menstruation. Now, let's delve into some risk factors which can lead to cervical cancer. First is HPV infection. Human papillomavirus HPV infection, particularly types 16 and 18, which are high-risk types associated with cervical cancer. Second is age. That is, women over 30 years old are at higher risk. Third, sexual history. Multiple sexual partners, sex at a young age, and lack of condom use increase the risk of cervical cancer. Fourth is hormonal changes. Hormonal fluctuations during pregnancy or menopause can increase the risk. Weakened immune system is the 5th point. Weakened immune system due to certain medications, HIV/AIDS, or other medical conditions can increase the risk. And finally, family history. Family history of cervical cancer or other gynecological cancers can increase someone's risk of this cancer. You have to take note that most women with cervical cancer do not experience symptoms until the disease is in its advanced stages. Therefore, regular Pap smear tests and HPV screenings can help detect precancerous cell changes and cervical cancer at an early stage. Women with a weakened immune system or a history of cervical cancer may need more frequent screenings. In conclusion, if you experience any of these symptoms or have concerns about your cervical health, consult your healthcare provider for a proper evaluation and guidance. Thank you for joining me in this educational journey. I urge you to share with others so they can also benefit from this. And don't forget to like, comment, and subscribe or follow this page. Until next time, stay safe.